Hi. Okay, so next we have behavior therapy. Behavior therapy is going to focus on changing the problematic behavior that the client has. All right? So, behavior therapy, this comes from way at the beginning of the term. Again, in the prologue, we mentioned behaviorism. Behaviorism is an early school of psychology focused on the behavior, right, of the individual or the animal, the environmental circumstances, the behavior of the organism, the consequences that followed that behavior. That's what you should focus on. Those folks thought, not psychological stuff, right? But just focus on that stuff. That's this therapy. They just want to change the behavior of the client for the better, right? Change the behavior of the client for the better. And there are different areas in the psychology of learning, which is this area of behaviorism, based on classical conditioning and operant conditioning, which we didn't cover that chapter this summer, but basically, you know, they have some therapeutic techniques they talk about based on classical conditioning and some on operant conditioning. Um, Pardon me. So if, for instance, you have a client who has a phobia, right? Has a phobia of something, there are different things you can do to try to basically extinguish that fear of that object or whatever it is they have the phobia of. And those techniques are based on classical conditioning. So you want to expose them to the feared stimulus with nothing bad happening. All right. So this approach assumes that the phobia was learned through classical conditioning at some point earlier in the person's life. Um, a neutral stimulus was paired with a scary stimulus at some point, and so that neutral stimulus became scary because it was paired with the scary stimulus. Now we need to expose the person to this stimulus that was not feared before. It was a neutral stimulus, but now it's a phobic object. Now they have this phobia of it because it was paired with something else scary, right? So we need to expose them to this feared object with no other fear invoking stimulus present, right? No other scary stimulus present, right? So if they've got a phobia of dogs, we've got to expose them to dogs without anything bad happening, and that phobia will go through extinction, right? Now, there are various ways to go about doing that. A very friendly way of doing it. So just exposure therapy in general, this is what you're doing, right? Exposing them to the feared object so that the fear will go through extinction or go away. They'll no longer be afraid, no longer have this phobia. A very nice, slow, friendly way of doing it, which is usually the preferred way of doing it, is systematic desensitization, right? The book calls it systematic desensitization. So you have the client create a hierarchy of fears, right? From least feared to most feared. So let's say if they've got a phobia of spiders, obviously the most feared thing would be like holding a tarantula in their hand. Freak out time, right? But then maybe a tarantula in a cage on the other side of the room, and then just seeing a video of a spider, seeing a picture of a spider, all the way down to just imagining a spider, right? Least feared, and so you have this hierarchy of fears that the client has made from least feared to most feared, and you're going to teach them relaxation techniques to calm themselves down, right? And then you're going to start at the very bottom with the least feared level of that hierarchy. What I want you to do is sit down, close your eyes. Now imagine a spider. Use those relaxation techniques we discussed. The breathing, calm yourself down. And you stay at that level of the hierarchy till they can imagine a spider and they're not freaking out, right? And then you move to the next level of the hierarchy. And you just very slowly, this takes however long it's going to take. You don't want to rush it, right? You don't want them to drop out of therapy. You do it very slowly until you do finally work up to them holding a tarantula in their hand, right? And of course, you can do this stuff nowadays with artificial environments, virtual reality goggles and that kind of stuff. They got fear of heights or fear of flying or something. So you can start introducing people to their fears in very slowly and gently until they can handle it with them out being afraid anymore, right? But you don't throw them in a room full of spiders if they got a phobia of spiders. No, you don't do that. Don't do that. Can't do that. You're going to get sued if you do that. So don't do that. But anyway, so that's an example anyway of a thing based on classical conditioning, systematic desensitization, which is an example of a type of exposure therapy, right? Exposing them to a feared stimulus or an object they have a phobia of, right, to get over that phobia. They mention aversive conditioning too, which can sometimes be done. Usually, this might be done as part of a court order treatment of someone with DUIs or DWIs. I forget which one is, whatever it is for alcoholism, right? So if they caught driving under the influence of alcohol, this could be part of their therapy. So the flavor of alcohol has been paired with positive stuff, with fun stuff. Well, what you want to do now in this aversive conditioning is pair the flavor of alcohol with illness, right? So that they won't like the flavor of alcohol anymore, and so they'll stop drinking, right? So you bring them in. This has to be under obviously a medically supervised situation, right? You have them drink alcohol. You give them the drug. That makes them very nauseous and maybe even throw up when they have alcohol in them. So you have them come in and pair alcohol with this illness, and then they'll be less likely to drink alcohol, right? The problem is this by itself doesn't always work because it doesn't. Whenever they go to the medically supervised area, to the clinic. Yeah, they never want to drink alcohol there. The problem is it might not generalize to, home when they're drinking, to another environment or the local bar or that kind of stuff. So I usually don't want to use aversive conditioning by itself in treating alcoholism. It'd be part of a larger therapeutic approach to try to help somebody stop drinking alcohol, for instance. So that's aversive conditioning. And then operant conditioning. Things based on operant condition. That's where you just reinforce clients for engaging in appropriate behaviors, right? So you want to see, so they're engaging in behaviors that are problematic, causing problems to them. Just reinforce them doing appropriate behaviors. So that's operant conditioning, right? You want to reinforce appropriate behaviors. An example of that they mentioned in the book is a token economy. It's called a token economy. Back in the olden days, they actually gave out tokens. So you often use token economies in institutional settings, right? Either prisons or psych wards, psych hospitals. You can do this at home with kids, right? So it's all very out in the open. Yeah. Here, these are the desired behaviors. When you get up in the morning, you make your bed, you earn 5 tokens, right? You carry out the trash. When you're first asked to carry out the trash, that's 10 tokens. If I have to ask you 2 times, that's 5, or whatever, right? You get an A, you get 10 tokens. So just, you reinforce appropriate behaviors. And then it can be tokens or points or however you want to set it up. And then at the end of the week or the end of the month, however you want to set it up, those tokens or points can be exchanged for reinforcers, right? Either the points determine the size of their allowance, or the points determine the number of hours they can play on PlayStation, or maybe the points determine, how many hours they can be on the phone. Whatever it might be. But so token economies work very well. Just when people do desirable behaviors, you reinforce that. That's it. You just have to be consistent, all right? If the kid doesn't make his bed, the kid doesn't get the 5 points. That's period, right? No, you only reinforce appropriate behaviors, right? Um, and you could work in punishment if you want to, in terms of maybe if they do something bad, you could take away some points. Um, but so you could work that in there too. But ideally, you can just focus on reinforcing appropriate behaviors, right? Um, so these work really well. The problem with token economies is that once the individual leaves that situation or that environment, those reinforcers are no longer the same, and so the individual's behavior changes, right? So you could have someone who's a model inmate in prison because when they behave, right, in prison, they get the job and they get to earn money or something. So they're just, yeah, a model inmate. They get out of prison, what happens? They leave that environment. They leave that kind of behavior is being reinforced, right, in prison. When they get out of prison, they go back to the old neighborhood. Appropriate behavior is no longer reinforced in the old neighborhood. What's reinforced in the old neighborhood? Well, the old bad behavior, and they go back to the old bad behavior, right? So that's the problem with token economies. And this can sometimes be the case too if a teacher at school has a token economy set up in her classroom. You can earn the stars, and you get so many stars, you get a toy or a toy box or something. So you can have a kid, once again, that's very well behaved at school and just is a terror at home, or vice versa, right? It's just because of the reinforcement contingencies in those environments are different, right? So just reinforce the behavior you want an individual to engage in behavior therapy. That's part of behavior therapy anyway. So that's behavior therapy.